The new 100.9 The Cat, number one for New Country. It's Jake and Dana, 807. Hang out with us online, 190cat.com. We are on Facebook, on Twitter, on Instagram, on SoundCloud, on YouTube.
Pinterest,
on
Tumblr.
Pinterest. Mm-hmm. You need that one in your life.
Yes, we do.
You have to find out what's good. We're tackling the real issues on Pinterest.
Yes, we are.
It's Total Wellness Tuesday. We're spending time with Dr. Catherine Wells. Welcome back.
Thank you.
Thanks for being
having
here.
me back.
From ImageCare Medical Imaging of Community Care Physicians.
Very good.
And today we're talking about a report that I don't know much about and you don't understand.
It came out in the Times Union.
Well, it came out in a medical journal,
Okay.
New England Journal of Medicine, and the Times Union printed a summary of it last week. And the article, the study is, it came to some faulty conclusions.
Well, of what? What were they talking about?
Well, they were talking about screening mammograms. And basically, their study tried to show that we are overdiagnosing breast cancer with screening mammograms.
What purpose does that serve?
Well, they're concerned that we're overdiagnosing and leading to overtreatment, treating cancers that never would have bothered women.
They're trying to say that you're wasting money?
I think that's one of the things.
That's
kind of feels like that
the
based on what you
insurance
just
companies
said.
behind this. What's
that's a good question too. But basically, their study made one faulty assumption, and that skewed all their data, and it skewed their whole conclusions.
Oh, wow. What was that?
Well, so, the study tried to show that we are diagnosing more breast cancer than we would expect to see in the population and causing this overtreatment. But in order to figure out if we're overdiagnosing, we need to know how much breast cancer would we expect to see. How much is out there?
Yeah.
And that's where they made their wrong assumption. They assumed that there's been no change in the amount of breast cancer in the population over time. But
Well,
those
that
of
doesn't
us-
make any sense.
No,
Things are always
Yeah.
changing.
Exactly. And so what we know, those of us who work in breast cancer, we know that breast cancer has been on the rise since the 1940s, well before screening mammograms came into play. So we can't blame screening mammograms for this increase in breast cancer. And they didn't account for this increase over time. When you account for this increase over time, their data actually shows that screening mammograms are saving lives left and right.
Oh, wow.
Yeah.
Yeah.
No kidding.
Yeah. Yep. There, even a graph in the paper shows this.
That's got to drive you crazy when you see stuff like
It's
that.
so frustrating.
I bet.
It's so frustrating.
You spend so much time trying to
Yeah.
help people, educate
Exactly.
people, and really educate people.
Exactly.
Because your job, of course, is to assess and understand, but you need to educate people so they know what's going on.
Right. So they're comfortable coming in. They're
Yeah.
comfortable. Exactly.
Well, that's the whole point of having the screenings, is so that we can catch it before it spreads
Exactly.
and gets into the stage 4 and the worst stages. And that's why I'm like, why would they put that out there? I don't understand why would they, because it is a preventative measure.
Well,
that's what the screenings.
Right.
You're not gonna blast them like I
No.
would. So I'll say why I think they put it out there.
All right.
I think they probably put it out there to instill fear, because when you do that, you control a little bit better. And in this world that we're in, it's so easy to instill fear. I would say, rather than empowering people to take away their time and their trust with doctors and with medical professionals, that they ask questions to those medical professionals. Because reading it out of an article, in my opinion, is a person writing information down that has been approved by another editor who may not understand it entirely,
Right. Yeah.
but says, well, you know what, it sounds great. Let's get it out there. And then, a subject matter expert like you, like Dr. Catherine Wells, comes in here from ImageCare Medical Imaging of Community Care Physicians. How'd I do?
Very good.
And, wants to really convey a clear message that there is a real problem and that we need to keep assessing and we need to keep looking into things.
Yeah.
And don't let an article from some newspaper empower you to make your own decision. This isn't WebMD. That never works out for people. You need to spend time
But
with
a
a real
lot of
doctor.
people, that's the thing. A lot of people will read this article.
same thing as
and
WebMD.
Yeah,
That's
true.
yeah, that's the thing.
They're
But people
empowering them to
believe
make
it. They
these
believe
choices. I
everything.
don't like
That's
that.
the problem.
Right.
Well, okay, so based on that article, then, it's telling people that maybe they should reevaluate how much time they spend getting checked up. And you're here to say that don't listen to that. That's
Exactly.
Mm-hmm.
Please don't listen to that. Please don't listen to
Put
that.
yourself first. Think about your
Exactly.
family. Think
Yeah.
about
That's
yourself.
That's right. Yep. A screening mammogram is a quick test, easy to do, and it saves lives.
Yeah.
Yeah,
And-
that's what
and
it comes
it's-
down to.
This month is
Yeah. Mm-hmm.
all about Breast Cancer Awareness Month. We know that, Breast Cancer Awareness Month. And with all of the conversations taking place, it's important that, we keep bringing it back to the fact
Yeah.
that one screening could really change your life.
Absolutely.
One screening could be the game changer that puts you back on track in life. So.
Yeah, it has to be done, and everybody needs to get one. Or
Yep.
women, we need to get one.
Starting at 40.
I'm
Yes.
getting fired up over here.
There you go.
Good.
She likes that.
I do.
So this was a report that recently came out. If you happen to see it, don't pay attention to it. I do want to touch on that, by the way, before. What about WebMD? Does that drive you crazy when people come in there and they say, listen, I've looked up all of my symptoms and things that bother me. And, because I know you're a subject matter expert. You're specializing in one area.
Yes, one area. And I mean, I think it's not a bad thing, I think, when patients come in and have questions about things they've read. I think it's a good thing. People are empowered. People are trying. People are looking things up.
But they freak themselves out sometimes,
yes,
right?
that is unfortunate. You can always call us. Call us at ImageCare, call us at the breast center with any questions you might have about screening or other.
I think the one good of that is because that means they've had a concern and they're paying attention to their body and something is going on. And then they're coming and saying, okay, here's what I found, even though it would set their mind at ease that, okay, this was wrong. You're right.
I'll tell you what.
We hope.
Right.
The best thing to come out of that article was this conversation.
Yes.
Unfortunately, because it had to happen.
Yeah.
Well, it gives us a chance to remind people and highlight that screening is so important.
All right, get screened. Ask questions. Talk to your doctor. And if you don't have a doctor and if you haven't considered this as a serious thing in the past, we've talked about age and stuff before too, but let's just reiterate real quick. At what age should you be really taking this serious with your screenings?
Screening mammograms should start at age 40.
Okay. And then if you've had any history in your family, a lot sooner.
Yes.
Yeah.
Anyone with a mother or sister who's diagnosed with breast cancer at 50 or younger should start sooner.
Okay.
Yeah.
Get a conversation going. And Dr. Catherine Wells from ImageCare Medical Imaging of Community Care Physicians here to help you as well. You can always message us too during the show if you have questions or thoughts, because during the month of October, we're hanging out with you guys.
Yes,
you
we
get
are.
to come back and we can ask you questions, right?
That's right.
All right, cool.
Yep, and it's all on our Facebook page. If you have any questions or want to link up, it's on through our webpage at 109thecat.com.
8:14. Did we cover pretty much everything?
I think we did we?
I think so.
Thanks,
Okay,
Doc.
good.
Appreciate it. It's Jake and Dana on the Cat. Link up and check out everything right on our Facebook page.
Jake and Dana in the morning.
Good morning, everybody. Turn it up loud right here.
The new 100.9 The Cat.